Craniosynostosis is a rare condition affecting about 1 in 2,500 babies that results in the skull plates fusing together earlier than they normally do. And so when this happens, it almost always changes the shape of the skull and sometimes the face, and this can result in a significant aesthetic concern. But apart from the changes in appearance, these children are also at risk of having other problems such as raised intracranial pressure, as well as functional problems of the face if this is involved. Although we can identify a particular genetic cause for a small number of patients with craniosynostosis, this is not the case for most cases. A small number also have another disease, which occasionally you get craniosynostosis as part of the condition, but it's not the primary feature. So for the vast majority of about 80% of patients, there's no single cause, and so we attribute it to a combination of factors. I often find that the diagnosis of craniosynostosis is often suspected by the parents of the child. The baby's mother will almost always have a feeling that something is not quite right and get straight onto the internet. And parents really are the child's best advocate. And although it can be difficult to find good quality information, I find that most parents will find enough to support their suspicions and push for a referral. As a craniofacial surgeon, I'll often be able to confirm the diagnosis at the first appointment and reassure families if their child is healthy. In a few cases, further investigation such as a CT may be required. With the right care, the majority of children with craniosynostosis will live happy and healthy lives. So if your child has craniosynostosis, it's really important to have them assessed by a specialist in craniofacial conditions, such as craniosynostosis, to ensure that they get this care. And this will include monitoring them at regular clinic appointments to ensure that any problems are detected early enough to allow treatment before there are any long-term effects. Certainly, there are treatments to alter or correct the head shape differences that children with craniosynostosis have. There are also very effective operations to enlarge the skull to treat raised intracranial pressure, which also improve the skull shape. So in this sense, craniosynostosis can be fixed. We don't yet have a way of preventing craniosynostosis from occurring in the first place, and so it's really important for children to be referred as early as possible to ensure that any problems are detected early and that all treatment options are available to them. So this is very much dependent on each case. The main indications for treatment are to change the head shape and to treat raised intracranial pressure. So if I suspect raised intracranial pressure or significant functional problems in a child with craniosynostosis, then surgery is usually recommended as soon as possible, irrespective of age. In general, though, surgery to the skull is performed in the first 2 years of life, with some of the minimally invasive procedures needing to be performed much earlier, say before 5 or 6 months of age, for the best results. In children with syndromic craniosynostosis, there's also undergrowth of the facial bones, which may have really significant effects with how these children breathe and eat. And underdevelopment of the eye sockets can make it very difficult for them to close their eyes, which ultimately can be a risk to their vision. In these rare cases, I may recommend surgery in the first few years of life. And in those without significant functional problems who want to alter their facial appearance, there's a real benefit in delaying surgery until they're a little older. So this enables me to really involve my patients in the decision-making for these appearance-changing surgeries and the changes that will be more predictable and long-lasting.